नमस्ते, हमेशा खुश रहो बिटिया. This is JV'n, Dr. Meenakshi Soni, Department of Homeopathic Repertory, Faculty of Homeopathic Science, Jyoti Vidyapeeth, Women's University, Jaipur. This is our clinical class case worked out on Boning Hassan Therapeutic Pocket Book. This is the extract from the Boning Hassan Therapeutic Pocket Book. This case offered comparatively few symptoms, but those few symptoms so clearly cut that we have found them illustrative four necessary elements which we must have to use as a foundations for our perfect case. This man suffered terribly with tic doulorex, the intense spasm coming at about 5-minute interval. There are acute pulling pain in the left trigeminous nerve accompanied with marked flushing of face with profuse sweat on head and chest. The upper jaw and cheek were very tender, painful. He conditioned very greatly by aggravation, touch, excitement, or talking wet weather at night, and by rubbing amelioration. With this condition, there was ravenous hunger, which always came on with the attacks, and his history divulged the fact that he had for year for year a discharge from the ear which had been stopped 8 years ago by an ear specialist. Since he then he had suffered from these attacks and which were increasing in the frequency and violence. Now let us see what a well-rounded repertory analysis can make of this case. First is the location, left side of the page, sorry. Checks, upper jaw, sensation, pulling sensation, condition of aggravation and amelioration by touch aggravation, by talking aggravation, by night aggravation, and excitement aggravate the condition, wet weather aggravate the condition, and amelioration only by rubbing that area. Concomitant, ravenous hunger, sweat upper parts, heat in flushes, ear discharge, so these are the concomitant. The concomitant symptom of ravenous hunger is one which seemingly has no relationship to the case, but it actually occurs in distinct relationship to the case and is the most interesting concomitant. The symptom of discharge from the ear might seem to have no relationship to the case, but since we find no rubric in Bonning-Hassan pocketbook to the suppression of ear discharge, since it was one of the first symptoms present in the chronic constitutional condition of the patient, we are certainly justified in using it our analysis. From these 14 rubrics, then we work out the case. Let us consider those remedies which came from these rubrics having 12 or more symptoms. They are the arsenic, bryonia, calcarea carb, causticum, china, kali carb, merc, nitric acid, naxomica, phosphorus, pulsatilla, rustrock, sepia, seditia, spigelia, stannum, met, Staphysagra sulfur. Calcarea, caustica, murphos, rustrox all lack the characteristic sweating. Note the difference between the sweat of upper part and the sweat of anterior part of calcarea carb. Causticum lacked aggravation with weather. The trembling and twitching of chronic murk was case was absent, and neither did this patient have the general constitutional symptom of phosphorus or the rustrox. Though the characteristic pulling sensation was absent from arsenic, calcarea carb, china, algae carb, nitric acid, sericia, arsenic lacked also the wet weather aggravation. China lacked the relationship to discharge from the ear. Nitric acid lacked talking aggravation, and pulsatilla sepia, sericia lacked the rubbing amelioration. Nux vomica and sternum have no relationship noted to discharging the ear, and spidelia lack excitement aggravation. So in Bryonia, this is covered the 14 by 55, matlab 45 marks and 14 symptoms. Sulfur covered the 58 marks and 14 symptoms. We find every symptom present. The family attests to the fact that this man show marked irritability during the attack. Both Bryonia sulfur have marked irritability, so we cannot use this medicine as differentiation. We might have used this as a rubric analyzing the case for further means of differentiator. Let us consider the depth of disorder and fact that while the ear was not discharging at that time, we must consider the significance of these symptoms coming on after the ear discharges were suppressed. Sulfur is one of those deep acting remedies that have the power to unlock the old symptoms of suppressions and to open up masked conditions, and it has also the power in itself to carry the case on many times to complete a cure. So this consideration confirmed our decision to give the sulfur, and the final selection of the remedy is sulfur. So hope you understand this case that is from the BBCR. If you have any query, please mention in the comment box. Thank you.